Hi, everybody. This is David Nevins for Citybiz List, and welcome to our program today. We have a very special guest, and she is Jorey. And Jorey is the president and CEO of the Immune Deficiency Foundation. Quite a mouthful title there, Jorey. Welcome to our program.
Well, thank you so much for having me.
It is our pleasure indeed. So, Jorey, I know that you are, again, as I said, the president and CEO of IDF, the Immune Deficiency Foundation, and you deal with primary immunodeficiency diseases. So let's begin at the very basic level. Educate our audience as to what those diseases are and what your organization does to advance the cause.
I would love to, because primary immunodeficiency is also a mouthful. So the Immune Deficiency Foundation focuses on people affected, just as you said, primary immunodeficiency. That's when you're born missing part of your immune system or your immune system doesn't function properly. And it's interesting, though, because primary immunodeficiency isn't just one condition. It's actually an umbrella term that covers and represents more than 450 rare chronic disorders, but they all have one thing in common, and that's the body's immune system's inability to fight infection. And what's interesting is the conditions are caused by hereditary genetic defects, and they can affect anyone, regardless of your age, of your gender, even your ethnicity. And you can feel scared and overwhelmed and isolated and maybe unsure how to navigate your journey with this diagnosis. And that's where the Immune Deficiency Foundation comes in. So our mission is to improve the diagnosis, treatment, and quality of life for people that are affected by primary immunodeficiency. And the way we do that is we foster a community, and we empower that community through education, advocacy, and research.
So I know that we've all for the last couple of years, Jorey, experienced COVID-19 and the pandemic that we've all learned how to live with. And in some ways, and of course, in a number of people, that caused a compromised immune system. So tell me a little bit about, did that involve your organization's work? And also, it seems to me, COVID-19 was not a good thing for the country, nor was it a good thing for the world, quite clearly, but it may have helped advance the public's knowledge of the kind of work that your organization does.
It really did. And if anything, what was interesting to me is that a lot of people know what it feels like now to wear a mask and to self-isolate. So COVID-19 remains to be a top concern and priority for the primary immunodeficiency community. So just a little bit of background, in the US, there are millions of immunocompromised people who are at risk or are the highest risk of contracting COVID-19. And obviously our community is among this group at risk. And so we hear a lot about vaccines. And while vaccines provide that first layer of protection against COVID, because you create an immune response, people living with primary immunodeficiency, which we call PI, so I may refer to it as PI, people living with PI, they might be unable to create an adequate response to a vaccine because their immune systems may not build the necessary antibodies that are needed to fight against that infection. So whether it's the latest variant or subvariant, or even as we're seeing an easing of restrictions, people are looking for ways to return to normal. But our community, there's a vulnerable patient population who really cannot, and they really have to be vigilant and take precautions. Because again, what I said and what I experienced myself, I joined IDF in January of this year, so I wasn't with them during the early stages of the pandemic. I was with another nonprofit. But what's been interesting is as many of us firsthand learned about, what it means to wear a mask, what it means to isolate. But if you're immunocompromised, and especially if you have primary immunodeficiency, this was a regular occurrence pre-pandemic.
Right.
Our community is constantly having to navigate a world where you're kind of mitigating risk and exposure to infection to the extent you can.
Well, and as you noted, yeah. So it was in the last couple of years, people have been wearing masks, and those with COVID had to or a family member with COVID had to self-isolate. But in most cases, we're talking about a week or 2 or 3. Your patient population doesn't get the benefit of a week or 2 or 3. Again, Jorey, share with us just a little bit about the kinds of activities that your organization is engaged in to, kind of both advance research and better treatment and to help this patient population, which I know you're quite passionate about.
Well, whether you realize it or not, you kind of hit on one of the key areas that we provide, which is support. But let me give you kind of a broader picture of what our mission looks like in reality. So the Immune Deficiency Foundation, IDF, we consider ourselves and strive to be that trusted source of information on primary immunodeficiency. And what we do is we provide a lot of educational opportunities so that people can learn about their diagnosis. Again, remember, there's an umbrella of so many different diagnoses.
Right.
And what's really important is we provide ways to connect to others. We provide ways for our community to meet other people, speak with other people who truly understand and share their journey. We invite our community and anyone to help us advocate before policymakers it could be removing barriers to treatment, or it could just be being that voice for the immunocompromised on a variety of issues at the state level and the federal level. And we really strive to provide science-based and I guess I will say data-supported information on primary immunodeficiency through our research efforts. And you mentioned those. And why this is really important to us is because worldwide, it is estimated that between 70 and 90% of people who are affected by PI have not been diagnosed. And that's particularly troubling because the average time to diagnosis from when you start having symptoms to when you finally have a diagnosis in hand can be anywhere between 9 and 15 years. So at the Immune Deficiency Foundation, while we are focused on serving our existing community who likely already has a diagnosis, we're also turning attention as well to the undiagnosed. We're trying to shorten that time to diagnosis. We are working to reduce health disparities, increase access to care, and just really trying to diversify and grow our community of patients and caregivers.
Again, fascinating, and certainly an effort. That we wish you luck in all those things. I know also you are out there encouraging plasma donations. That's a specific thing that people can do. Why is that important?
This is like COVID. This is actually another issue that is so important to our community. So I'm glad that you asked it, because about 70% of people with primary immunodeficiency, they have this condition, they get a treatment that's derived from plasma. And specifically, when we're talking about, things that are a mouthful, here's another one, specifically immunoglobulin replacement therapy. So if you'll give me just 30 seconds, let me give you a quick soundbite on that. So over half of your blood, and these are things that I had to learn too coming into the organization, over half of your blood is made up of plasma. And while the majority of your plasma is water, there are also some really important proteins in your plasma. And those include these immunoglobulins, but basically, easier to say, those are your antibodies. So antibodies, as we all know, play a big role in our immune system. They fight viruses and neutralize bacteria and they fight infection. But for many, this is the only, if you have PI, this is the only option of life-saving and lifelong treatment because it's a treatment, not a cure. So what it is immunoglobulins given to people with a primary immunodeficiency, and it replaces what the body should be making, but it doesn't stimulate someone's own immune system to make more. So that's why it's a lifelong treatment. It's not a cure. But here's kind of the catch or part of the issue. It takes 130 donations, 130 plasma donations to treat one person for 1 year with who has primary immunodeficiency. And COVID, so these two topics are kind of interlinked. COVID had a real impact on people's ability to donate, and it caused a drop in donations. And so understandably, that raised alarm bells among people who rely on plasma-derived therapies. And the last thing I'll say around on in terms of who uses plasma and why it's so important. So it's so important to our patient population. But there's plasma-based therapies can treat a wide range of conditions outside of PI. Plasma proteins are used to treat burns. They're used in major surgery, in organ transplantation, and even to treat some autoimmune disorders. Those are just some examples. So a lot of people should be focused and interested on plasma supply.
So I know, Jorey, that we're speaking here. The summer's more than half over. Yikes! Right? That went by fast. And fall is a busy time for you and your colleagues at IDF. I know you have a series of walks and a national conference. Can you tell us a little bit about that and maybe share with us ways that some of our viewers can get involved with IDF and helping you achieve your goals and objectives?
Well, we would absolutely love that because we have such a busy fall planned. You mentioned some of it. We have our premier educational event for our community. It's our PI conference, and that is October 6th through the 8th. It's a virtual nationwide conference, but with an opportunity to connect in person in 3 cities because we're living in that kind of hybrid world ourselves. And we will kick off our Walk for PI campaign actually on July 28th, but we have our events occurring in the fall. And Walk for PI is just I think anyway, of course I'm a little biased, I think it's a great opportunity and a fun way to fundraise or friend raise for our mission. We have physical walks around the country, but we also have that hybrid approach where we have a coast-to-coast virtual walk that people can participate in. But for both of those, you can learn about our events, including our Walk for PI conference on our website. It's primaryimmune.org. And while you can learn about our Walk for PI as well, you also can learn really the most about Walk on our specific Walk website, which is walkforpi.org.
Jorey, it's fascinating to me that, and I'm sure most of our viewers would think the same, that you've learned so much I almost felt like calling you Dr. Barry, but I know that you're not, and that it seems as if you've been with IDF for 10 years, given your degree of knowledge and passion about the organization's work. Just before I let you go, just share with us a little more. What did I not ask you that folks should know about the work of IDF or the care for your patients?
I think one of the greatest takeaways can be, in addition to hopefully going to our website just to learn more about the organization, is that journey to diagnosis, that 9 to 15 years. People ask, well, why does it take so long? Well, remember, it's a bunch of different conditions, and you may have that recurring sinus infection. But if you have an infection that is severe or persistent or unusual, it's recurring. If this is you and you feel like you're sick more often than you should be sick, I would just encourage you to go to primaryimmune.org, IDF's website, and look up our kind of, is it just an infection? We have kind of a little checklist. Is it just an infection? So that you can empower yourself and your health and to have conversations with your healthcare providers. In addition to learning about our organization and ways to get involved, also, it's a good way that we can try to close that gap, that 70 to 90%. We don't want that. We want that statistic to reduce.
And I know, Jorey, also, you are a national, if not an international, organization. And though you are based in Towson, Maryland, you have folks all over the country, and your organization operates somewhat virtually in terms of administration and so forth, correct?
It is, and I can't hide my accent. I am based in Texas, so
you're not a Marylander by birth.
I'm not, and I can't pretend to be. I am based in Texas, obviously from my accent. I was raised in Texas, but this is we are a distributed workforce, but this is also very natural for me personally. Just to share a little bit personally about that, I've managed a distributed workforce and have been a remote employee myself since 2005. So that's been a really long time. But to your point, the Immune Deficiency Foundation became truly a remote workforce since the pandemic. So we have our hub office in Maryland, and we come together as a full team a few times a year, but we are a national nonprofit, and we have staff currently right now in 12 states across the country. So that's been, it's been an interesting experience, but it's something that can be done really well, and you really can build relationships remotely, just from an organizational perspective. But it also has really opened things up for us and how we provide virtual programming as well. And looking for those ways with our community of all the benefits of virtual programming, and also listening to our patients and caregivers to find those moments when they do want to come together in person, and navigating that very carefully.
So once again, just before we part ways, Jorey, let me just ask you, how can people reach you and become involved, either as a gift giver or a plasma donor, or just to learn more and help spread the good word of your good work?
Well, you definitely can learn more about ways to become a plasma donor on our website at plasmahero.org. But if you don't want to remember all these different websites, you can just go to the Immune Deficiency Foundation's website, and that is at primaryimmune.org. We have an Ask IDF option, and no matter what your question is, whether you want to get in touch with me, whether you want to become involved in WALK, whether you have a medical question, whether you want to learn more and can't remember that plasma website, you can go to use Ask IDF, go to that portal, and we will connect you with the right person to get the answer to your question.
Thank you so much, Jorey. It's been a real pleasure.
Thank you.
This has been David Nevins for Citybiz List today, and our guest has been Jorey Berry, President and CEO of the Immune Deficiency Foundation. Look them up, give them a call, or just simply encourage their good and outstanding work. Thank you so much for watching today. Thank you, Jorey, for joining us.